So I'm going to go over chapter 13, which is Transition to Parenthood. And this chapter really talks about role transition, responsibilities, some of the stressors um, of being a new parent. And because remember, even if it's the second or third or fourth child, that changes the dynamic of the family. I'm not going to go over these objectives. I'll let you read those. So all of these factors have to do with parenthood and the changes and transitions. So previous life experiences, have they, what kind of work that they did, what kind of education. The couple's relationship has a lot to do with it. Financial concerns, education level, support system, and the desire to be parents and the age of the parents. So, how long have they been in a relationship together? Are they really worried about, financial, like taking care of their babies or child care or being able to go back to work? There's so many different things that can be a factor. So, parental roles, the theory. So, there's a little bit in here about, you know, what level of developmental stage might they be in. Um, Again, we have different roles throughout our lifetime. What are the expectations of them in their particular age group? So, um, couples usually are given the title of mother and father with the birth of their child, and they must learn what that means, what it means to be a mother, what it means to be a father. So expectations, responsibilities, anything that they observed as they were growing up, most people kind of follow along with that kind of idea of what it means to be a parent by looking at their own parents. So this part about becoming a mother, Mercer's 4 stages of becoming a mother. So Mercer describes that these stages are commitment, attachment, and preparation for an infant during pregnancy, and then acquaintance with and increasing attachment to the infant, learning how to care for the infant, and going back to their physical state in the early weeks after birth, moving toward a new normal during the first 4 months, and achievement of maternity identity around 4 months. Then, this process starts during pregnancy and it continues on as the mom gets used to her new baby and her new life with her new baby. Some of this preparing to become a mother is affected or influenced by, how the woman was parented by her mother, her unique characteristics or her life experiences, and the birth experience has a lot to do with it as well in the pregnancy. So they will rely on support from their partner, family, and friends. So if those are not really great, that will also affect becoming a mother and her willingness to become a mother. And then the infant's appearance and temperament also has a role. Nursing, what we do is we want to review the prenatal and labor records. We want to look for risk factors and complications. Try to help the woman get through the becoming mother phases, just identifying if there's any risk factors, encourage positive feelings and attachment to her new infant, nurturing behaviors, bonding, that kind of thing. We're really looking for that bonding with both the mother and the father. And that's why rooming in is really helpful, so that the baby's there all the time and they can get used to listening for their newborn, what they should do, cues that they should pick their newborn up, and that kind of thing. I'll bring your attention to Reuben's maternal phases. Of course, there's always a test question on some of these. That's in table 13-2. But an overview is that there's the taking in, the taking hold, and the letting go. The taking in is that first 24 to 48 hours after birth, and the woman is focused on her personal comfort and physical changes and her birth experience, adjusting to the physiological changes and the psychological changes. So that's kind of taking it all in. And then the taking hold phase, she becomes, you know, focusing on moving from her focus for herself to the infant, beginning to be independent, making decisions, and caring and interested in her newborn's needs, etc. There's quite a few things there. And then letting go, the movement from independence to the new role of mother, is where it becomes fluid and interchangeable with the taking hold phase. And grieving and letting go of old relationship behaviors in favor of new ones. So incorporating this baby into their life where it becomes a new family unit, and the woman is now accepting the newborn and giving up any ideas of what it was like prior to this newborn being there. So it's kind of like, okay, I can't imagine life without this baby. And there's a clicker question. There might be a few more at the end of the slides. So fathers also have a little transition period, but it's a little different than women's, and you can kind of read about it here. But a lot of the values of the father depend on the role that they had as they grew up, how they were fathered, what their culture defines as the role of fatherhood, and sometimes by friends and family or their partners. So that can certainly influence the involvement of the child, based on with the baby, with the newborn, based on what the partner or the wife feels that she needs. And then, of course, developmental stage and age depend on how the father gets involved. If there's, concerns about finances, work, those kinds of things all play a role. Adolescents are taking on this new role of parenting at a time when they're still going through growth and development themselves. So this is a very difficult transition for an adolescent. So they don't have a lot of life experience that prepares them for conflicts and strain as first-time parents come in contact with. And then adolescent motherhood is viewed by the adolescent woman as either a positive or a hardship. So it could be a positive turning point or a really difficult transition. Often adolescents will live with their families until they can get on their feet, but some do get pushed to live on their own and they don't have a lot of support. And then if there is a supportive relationship between them and their mothers, this is often helpful for parenting. The father as well the adolescent's father can get involved, and also that promotes a positive relationship. Nursing actions, you're going to need to do a lot of teaching maybe for an adolescent, understand their level of understanding and knowledge, and what kind of learning would be most appropriate. Really do some basic infant care teaching sessions with them. Involve the grandparents. Expectations. Talk to adolescents about expectations, what to think what's going to happen when they get home. A lot of discharge planning, a lot of teaching. Another clicker question for you to answer. So bonding is something nurses assess for. That's one of your nursing action is trying to identify couples at risk early on so we can set up some support systems for them. We're going to be assessing their belief system, their bonding and attachment. We're going to observe them interact and see how they actually connect with their infants. And that's something we do document as well. Are they holding their infant close? Are they referring to them by name? Are they responding to their needs? Are they speaking positively about the infant? All of these things are expected findings, but if they are not, some maladaptive assessment findings might be calling their infant an it, avoiding eye contact, not responding when they cry, not being emotionally available. So these are things we need to look for and document. Also, we're going to be teaching them how important it is for them to hold their babies. There's a couple things called like in face position. If the mother is in the in face position, she's actually looking at her baby, cuddling her baby, talking, singing, kissing her baby, breastfeeding, holding her baby close. Okay, so then there's responding to the infant. The infant responds to the parent's comforting measures, and the parent stimulates and entertains the infant while awake. So listening for their baby's cues. This is really important for us to assess and be able to teach about as well. So again, the parent-infant contact is something that we're going to assess for. Dads should get involved. Something called engrossment, where the new father experiences an intense preoccupation about their newborn, and so they'll really be focused on that newborn, which is normal. This is great. We're assessing that, the touch, the maternal touch is there, the paternal newborn interactions, looking for, positive, and then of course looking for any maladaptive or negative behaviors. Showing no interest in the infant or negative comments would be something we would be concerned about. We could do some role modeling if we feel like there's some maladaptive behavior going on, educating parents, support systems, strategies if they're worried about, stress for any reason, about, waking up at night, not being able to work, not having interest in their babies. We're going to be looking for all these things. So again, here's dad showing signs of engrossment. I think I talked about this one, communication between parent and child. It's bidirectional, involving the sender receiver. Written communication, verbal is the usual way, but newborns have the ability to see, hear, and smell and respond to their environment and display displeasure. So we're hoping that parents will be communicating by cues, crying, cooing, facial expression, eye movements, smelling, cuddling, all of the things that we want to do with our infants, newborns. So they communicate by all of those methods. So parents have to respond in the appropriate way to understand their newborn. The best time to communicate with their newborn are ways to comfort, methods to assist infant to self-comfort when the infant is overstimulated, quiet times, for periods of fussiness. So these are things, again, we could teach parents about. We can role model, we can praise them for their interactions with their infant. We can teach them on how to communicate with their infant. Here's another clicker question. Parents that have visual or hearing problems, this may be something you come across. So there's a little, ways you could work with parents with sensory or physical impairments, different ways to teach them. Don't refer to the woman as a blind woman in room 211. Address the patient or the mother by name. Introduce yourself. speak directly to the person in a clear manner. So there's a lot of little things you can do here that are on this list about communicating with visually impaired and then hearing impaired as well. And then, of course, we do need to provide ADA required physical facilities if they need it. So raised toilet seats, wheelchair accessible rooms, easy to use call buttons, those kinds of things for disabilities. So those are things we can work on an individual basis, assessing parents and providing their needs if they need something special. Postpartum blues. So these are known as the baby blues. Okay, so the first few weeks of postpartum, most women actually have some form of this, a little bit of sadness, a little bit of crying. Hormones are usually what it is. It's the change in hormone levels. And this is pretty normal. It's when it becomes beyond just a little bit of crying and a little bit of feeling sad, when it could go into a postpartum depression or psychosis. So we worry about those. But again, the postpartum blues, pretty typical. Changes hormone levels. They get tired. They get stressed from the new role of mother. Signs and symptoms are usually anger, anxiety, mood swings, sadness, crying, weeping, not being able to sleep, not being able to eat. We want to teach them about this, and we want to teach them the importance of getting help and support if they need it. And they should have a plan ahead of time rather than wait till things get out of control. They'll be asked about this in their postpartum visit, but if they experience some depression, they should definitely notify their provider. You can review the case study at the end here, because that's all the slides I'm going to do, but if you have any questions, please send me an email.